Good afternoon, everyone, and thank you for joining us for another Secret Sunday session for 2023. Today, I'm joined by Natalie Rose, and we're going to be talking today about eating disorders. So Natalie works in the space of being an eating disorder therapist, working with a lot of clients in this area, helping them go through recovery and learn how to better have a relationship with food and exercise. So to kick us off, like always, before we get into a lot of the details surrounding eating disorders, Natalie, I'm going to throw over to you. For those people that don't know, who are you and what is it that you do with yourself?
Yeah, thanks for having me. My name's Natalie Rose, and I'm a therapist. I work in Toronto, Ontario, Canada, and I specialize in eating disorders and disordered eating, and I work mostly with adolescents and adults. And my role is an outpatient program. So it's not in a hospital, it's through a clinic and it's virtual. And I also provide coaching for people worldwide who want to improve their relationship with food.
Amazing. And how long have you been in this industry for?
I would say I started specializing in eating disorders during the pandemic. So maybe a couple, 2 or 3 years ago.
Mm. And what pulled you towards the industry? Because it's not normally something that people are like, yes, I want to work in eating disorders.
Mm. Yeah, it's a pretty challenging population to work with. I think one of the reasons was probably because eating disorders skyrocketed through the pandemic. Just the prevalence of eating disorders really, really grew, and hospitals were full. They still are. They still have massive wait lists. I'm not sure what it's like over there, but here in Canada, the wait list can be up to 2 years long. So they really geared up outpatient programs to offer more support to people. So I think there was definitely more of a pull towards that. I think also my Instagram had something to do with it because I have an Instagram where before the pandemic, it was more of a blog. So I would share my breakfast bowls. Breakfast was my specialty. I wake up and smell the rosé. And so I grew a following through there, and I would share about my experience with disordered eating and how I stopped dieting and was improving my relationship with food. So I gathered that a huge part of my following also either were struggling with their relationship with food or have been. And so the two sort of merged as I was studying, or I was already a therapist at the time, but started my Instagram when I was doing my master's and decided to merge my Instagram into my therapy practice. So just how to take what I was talking about with food and developing a healthier relationship with food and turn it into a career. So that's sort of how it came about.
Amazing. It's the world of social media at the moment where you can sort of fall into things and then before you know it, you have this following and you can really start some amazing conversations in that space.
Yeah.
Looking at your history as well, you said that you used to, struggle with some eating disorder habits and traits. Did you find that hard then transitioning into working as an eating disorder therapist? Did anything come up for you that made you triggered?
It's a really good question. And I've gotten that question before, and I can't say that I've ever been triggered by my work. I don't know if I don't know why. You'd think that maybe hearing or working with experiences that might have resonated with me in the past might trigger something, but I have never felt triggered by it. I think I feel passionate. I think I relate to a lot of my clients and maybe have it maybe enables me to have more empathy for them, just having shared similar experiences, not necessarily the same experiences as all my clients because everyone's experience is different, but no, I can't say that it's that I felt triggered by the work, fortunately.
Yeah, that's great to feel like you can really make change in this space and know your story and come out of it and now be able to help others. That's pretty cool. Um,
Yeah.
Looking at now eating disorders, a lot of people are misinformed and don't know a lot about eating disorders. Could you give a brief explanation about what eating disorders are?
Yeah. So there's Different types of eating disorders. Some eating disorders stem from a fear of weight gain and body image discomfort or dissatisfaction. Some eating disorders have nothing to do with the urge to control weight that way. Sometimes eating disorders are more related to hypersensitivities. So sensitivities to taste, smell, texture, where it's difficult to ingest foods, and then that can result in malnutrition. But I guess for the purposes of our conversation, the most common ones that we hear about and that we see and that we struggle with are binge eating, restrictive habits, anorexia, bulimia, which involves binging, and forms of purging, and orthorexia, which is more of an obsession with clean eating or healthy eating, which can go too far and actually result in malnutrition.
Mm. Yeah, it's crazy the terms that you hear about today and how we are more aware about what eating disorders are and the different categories and what you can fall into. And a lot of people, there still is so much misinformation out there. And unfortunately, there is a concept that does come with eating disorders in the community that sometimes people with eating disorders are seen to be attention seekers. Why do you think people think that?
I think that it's hard for someone who isn't experiencing an eating disorder to understand really the function of an eating disorder and how it really distorts your perception of things, of food and of your body. A lot of eating disorder behaviors do function as a way to seek connection with others. So rather than attention seeking, I would sort of label it more as connection seeking. We live in a culture where there's a lot of pressure to modify your body in a way that it conforms to these unrealistic standards. And we're told that if we conform and we abide by those standards, that we will be more respectable, admired, worthy, and loved and cared for. So it really, to me, it makes a lot of sense why someone would be engaging in behaviors to lower their body weight if they're really being fed the message that that equates to success and well-being. I think the sad part is that that's so not true. Like, really true connection is not built based on our appearances. It's built through emotional connection and relationships. So, I think that really diet culture plays a huge role in that.
Mm. And do you believe that that's why statistics and numbers for people with eating disorders has increased during COVID and post-COVID because of that lack of connection?
Oh, definitely. I think the pandemic was a huge trauma in itself. It was traumatic and it still has impacts. And part of the reason why it was traumatic was because it cut us off from sources of connection and just outlets to alleviate stress. So people were really feeling isolated, and eating disorders thrive in isolation, especially as we're really trying to gain some control over something. And, we find that we can control our food.
Mm. And with that, like you look at symptoms for eating disorders and you go compare it to the world that we're living in today. And a lot of those symptoms are glamorized in social media and in the media. How do you then identify someone with an eating disorder if they're developing traits that people would think, oh, they're just being healthy?
Mhm. Yeah, that's a good point, because a lot of eating disorder behaviors are then praised and encouraged, even though they are disordered and can actually be causing a lot of harm. Eating disorders are easily missed, and most people with an eating disorder, you would never be able to tell just by looking at them. Even they even get by medical doctors, right? Like, say an athlete comes in and they look toned and fit and healthy, and they're doing their sport or exercising enormous amounts, and everything medically says that it's okay. Like sometimes you might see low heart rate or something like that, and a doctor might just say, oh, it's because they're an athlete, like that's expected. Oh, they're not getting their period. Oh, that's because they're an athlete. So some signs are actually shrugged off, and then other signs don't even show up because sometimes you can't see malnutrition on the outside. So it is really tricky. And I think one thing that's gaining more awareness is atypical anorexia, which is basically anorexia minus the criteria that the person has a really low weight, because often anorexia, malnourishment can still happen for someone, even if they don't appear thin or emaciated or sort of the stereotypical way that we've seen anorexia portrayed in the media.
And I think that's just another layer that can make it really hard to identify eating disorders in people, is when people have these perceptions that they have to fit a certain criteria and they don't, or they go, well, what's wrong with you? So yeah, it's a really difficult space. But looking at then, if we go into treatment, there are so many different treatments out there, and we sort of know that every person is different and we need individualized support for someone with an eating disorder. But what are the common treatments that someone can go and seek if they have an eating disorder?
Well, here the gold standard is a combination of therapy and working with a dietitian. Obviously, both therapists and dietitians specializing in eating disorders. Um, for younger clients, there's family-based therapy. So this is when the family is involved in helping with meal support and emotional support. Um, Inpatient treatments are well, that's the tricky part because the criteria is often very strict. So they have to filter it out somehow, I guess, because there's so much demand for inpatient treatments. So they will often filter it through BMI. So if you don't have a low BMI, you may not get accepted in. And that's sort of something else that invalidates a person's need for support, which is really an unfortunate thing. But I would say that if someone does have access to working with a therapist and dietitian, that would be one of the most common ways to get support and to get healthy again.
And in your practice, and obviously in Toronto, do you find that these treatments are working for people with eating disorders?
Yeah, we've had a lot of success, especially out of the clinic that I work with. We have an eating disorder program. So the requirements are that a client is working with a therapist and a dietitian. And depending on their age and their circumstances, their parents or their caregivers or loved ones can attend workshops that help them learn how to support the client. And they also get medically monitored every week to month, just to make sure that that as they're recovering, they're also healthy medical wise, as we can't determine that just as an outpatient program.
And you were mentioning before that there are a lot of wait lists, and unfortunately here in Australia there are as well. Why do you think that's the case? Are there more cases of people with eating disorders? Are there not enough staff? What's going on?
I think both. I think there's definitely the cases have risen over the pandemic, and there must be understaffed and just have not enough programs. I'm still sort of new to that area as well, of learning of, the different types of hospital programs and inpatient programs, but it does seem like it's really challenging for clients to get access.
And even as well, you hear about the relapse rates, and they seem quite high. How can someone with an eating disorder continue to fall back into old patterns? Like, why does relapse occur?
Yeah, I think this is probably a good time to highlight the genetic factor of eating disorders. So part of an eating disorder, there's metabolic differences. So even if a person, like for example, in anorexia, a person with anorexia can lose weight really easily and really quickly. Um, they just have a different type of metabolic functioning that they metabolize food and energy differently. So sometimes it's just completely accidental. Um, they might be just going back to their typical, whether it's exercise or a sport that they were enjoying, and during times of stress, maybe forgetting to eat or just not eating enough, and then it kind of builds up and just quickly, like almost it feels like they can lose weight or experience a caloric deficit overnight. Like it just can happen so easily, and that's kind of the scary part. Not to say that you can't fully recover from anorexia, but it does require a lot of maintenance. And I also think something that's missed is that often when clients are discharged from the hospital program, they may not have ongoing access to therapy and support. So they may be released prematurely. There's a lot of different reasons, but you're right. There is a high relapse rate for eating disorders.
And you look at that and you look, say, for example, with someone with anorexia, that if they, going to go back into an environment where they can lose weight really quickly, how can they prevent that and prevent from going down that relapse road?
I think developing a really comprehensive plan. Um, a plan of how to slowly incorporate exercise and movement back into their life while making sure that they're adequately nourishing themselves. And maybe that plan will involve regular follow-ups with the clinician. And for some clients, that might involve weighing as well. I know that's also kind of a tricky topic in eating disorders, whether to weigh or not, but sometimes it is a method of preventing a relapse.
Because what happens in the brain with someone with an eating disorder? Because a lot of people have this mindset of, just eat it, just eat the food, or just stop eating, stop binging. And I know it's not as simple as that. What is happening? What is the illness-based thing doing inside the brain of a person with an eating disorder?
Mhm. They've done a lot more research on anorexia, which is probably why I'll talk about anorexia more in this sense. But so the differences are sensory sensitivities and neurotransmission. So basically, a person with anorexia might actually feel more at ease in their body when they are restricting or eating less. Whether that's sensitivities, like they can feel the food in their bodies more acutely than the average person, or they eating creates more intrusive thoughts about food. So it's almost easier for them, like it's more comfortable for them to not eat than it is to eat. It's they call it's like an unsettled biology, meaning that by eating more, they're experiencing more anxiety and more distress in their bodies. So restriction is like a form of emotion regulation, essentially. Um, and so the idea in recovery is to rewire that, like to reverse that. But it can be difficult because sometimes it's just the way that their body functions. Like that's what's going on in their brains and in their bodies. And I mean, if you look at binge eating, sort of the opposite is true. Like they have seen that there's more dopamine being released when a person with binge eating disorder anticipates food or is eating food. So they're getting greater hits of dopamine and reward. So their brain is telling them this is good, this feels good, keep going. So I would say that those differences are pretty instrumental in the maintenance of eating disorders.
And looking at in that perspective, you can see why when something comes up for someone or someone is put into a stressful situation, how they then turn to eating disorders to cope and to get through whatever that they're feeling. especially
Mhm.
when it may come to, binge eating if they need that hit of dopamine to really cope and escape for what they're feeling.
Exactly. And another thing too is the effects of starvation make it very hard to eat
Mm.
again because there are many psychological and physical effects of starvation. So this can be just from chronic dieting or chronically undereating. Um, you might experience digestive issues, which then make it uncomfortable to eat more. Another thing is the effects of malnutrition can kind of cause like what we like to call a switch in your brain. It's like a switch is flicked where now every food choice or every choice about a new behavior is seen through a very fearful lens. So it's not rational, it's not logical, it's because I have been in starvation mode for so long, my brain is now afraid of challenging myself to new and different things in foods. So putting stuff in my body, putting more food in my body is scary. And
Mm,
it's like it's like, creating these feelings of fear and anxiety that make it really difficult to eat.
mm. And of all illnesses, your treatment plan is the food, and that is the one thing that you're fearful.
Exactly.
I mean, like it
Yeah.
must, and that's the thing coming through recovery, you build up so much strength then on the outside because you're constantly facing your fears every day because you have to eat during recovery. And I think looking at food as well as the treatment, especially in particular with anorexia, what is the nutritional standards do you believe in your practice and what you're seeing? Is there sort of a one sort of size fits all in terms of recovery with food, or is it very individual?
I wouldn't say that there's a one size fits all, but there is an approach that we use that seems to be very effective. And it's called the plate by plate approach, which means that every meal includes um, all three macronutrients, so protein, fats, and carbohydrates. And if you can, you're adding juice or milk or dairy, which has been, studies have shown that that has really aided in the weight restoration process. So we do recommend that eating regularly is often one of the first steps. So avoiding going longer than 3 or 4 hours without eating. So usually it's 3 by 3. So 3 meals a day and 3 snacks a day. And that's typically what we're trying to work up to in the initial stages of recovery.
Mm, amazing. And with recovery, there is a certain point where people generally restore their weight or are restoring their weight, and they put on a lot of fluid, like fluid retention is sometimes what people describe it as. And at
Mhm.
that point, people generally want to go, all right, I want to give up now because they put on a lot of weight and sometimes their body shape starts to change.
Mhm.
Why should they keep on going, and why is it important for their body to keep on pushing through that instead of going backwards?
Yeah, you're so right. It's the uncomfortable part of the healing process. I think what we like to say at that point is that they're not quite on the other side of it yet. And so there's a very strong pull to it's almost like the closer you get to getting rid of the eating disorder, the harder it fights back because it doesn't want to go away. So the eating disorder at that time will be pulling for any reasons to quit. This is uncomfortable. You look bad. Your body is, horrible thoughts and feelings. So we really just try to encourage that this is a temporary phase of discomfort. And after pushing through that, we usually then get to do more body image work as well. Weight restoration, usually we encourage that to happen before body image work, just because when you're weight restored, you have a clearer perception of your body as well.
Mm.
Whereas when you're underweight or malnutritioned, your perception of your body is quite distorted. So we usually encourage clients just to keep pushing through and not letting the eating disorder, fight back in that sense.
And that's so hard because being in that situation where you're at your end, excuse me, and you keep pushing, and then all of a sudden the eating disorder just keeps coming back, and it's coming back stronger and harder. And a lot of these people and families have been going through recovery for 2, 5, 7 years, some even 10 years, and now it continues to fight back. How do they keep going? What should be motivating them, or what should keep pushing them to get through when they're at the 10-year mark?
Mhm. It's so hard. I think just validating those feelings of discouragement, of grief for the amount of time that has been dedicated towards recovery or time that feels like it has been lost. Tons of self-care, both for caregivers and eating disorder sufferers. Um, community. Community is a big one with eating disorder recovery. You want to find something outside of your body, like you want to reconnect, reclaim your life, build a life worth living that doesn't involve physical appearance and food. Those things I find really helpful in pushing through those uncomfortable times and just acknowledging that it's also normal to feel that discomfort. Anyone eating with an eating disorder or without, feels uncomfortable when their body's changing. So just normalizing that part of it as well.
Mm. And you mentioned there that transitioning back into the community is a necessity for eating disorder recovery. Do you also find that those environments can be quite triggering for someone that's, been isolated for so long with their eating disorder, and then also going through treatment? It can be quite isolating. How do they then transition back into the community and not be triggered by, for example, common conversations like talking about dieting or talking about running or talking about what they're eating? How do they avoid being triggered?
Yeah. It's huge because diet culture is so pervasive. If you're going back into the workplace, there's so much office talk about diets and weight, and even just families who are unaware of the impacts of talking about weights and diets. Um, so this is stuff that we work on in therapy all the time: how to set boundaries, how to protect your recovery. I think it's important to specifically build a community of with other people who are overcoming eating disorders or who have overcome an eating disorder, so that it is a safe space where there is less of that or none of that kind of talk at all. Um, in that way, there's more of, embracing joyful movement, for example, without it being related to weight loss. And yeah, just really protecting the recovery at all costs. Another thing is, when you've been isolated for a long time like that, even just social situations in general can bring up a lot of anxiety, and social anxiety is hugely connected with eating disorders. So we work through that as well, just kind of exposing yourself to new situations and learning how to tolerate discomfort. It's a lot of it is tolerating discomfort, because there are going to be a lot of triggering things. And it's like, how can I get through this moment without making things worse?
And avoiding it as well, because you never want that person to avoid triggers for the rest of their life.
Exactly, because that will just increase the fear in the long run.
Definitely. And you mentioned before as well, talking about full recovery. I believe it is possible. And I know that you mentioned you do believe in it as well. What is your idea of full recovery? What does that look like for someone?
I think full recovery is when you're at a place where you can accept your body. Like, you might not necessarily like it all the time, but you accept it for what it is, and you're no longer experiencing distress to the extent that it's really impacting your quality of life. You're able to connect to other things and people that bring you joy. You're able to feel worthy and treat yourself as though you feel worthy. I think it's being able to attune to your hunger and fullness cues. So, knowing when you're hungry and eating what you're craving without any really restrictive rules or feelings of guilt or shame. I think a lot of therapists do talk about quasi recovery or more of like a harm reduction approach, where for some clients and maybe ones who have more of the other eating disorder maintaining factors um, like the metabolic differences or the sensitivities to food or autism, like things that make it very difficult to not have control over your food. I think sometimes a harm reduction approach is more reasonable for them, where you're able to reduce the significantly harmful behaviors and nourish yourself adequately. And there may be other eating disorder thoughts and behaviors going on, but they're not as severe or life threatening, if that makes sense.
Yeah, absolutely. It's been an amazing conversation today, and thank you so much for joining us. But I want to sort of end it off by saying, what would your message be to someone that is struggling with an eating disorder right now, or a family that is going through an eating disorder? Do you have any final advice or tips that you could send a message to them?
I would say to keep persevering. I know that it's a huge battle and it's a battle that's very much worth it at the end, and to find ways to nourish your emotions and your well-being, and really just to find joy and glimmers in everyday life, even when there's so much struggle going on. It can be helpful just to slow down and really appreciate the simple things.
I feel like that's something we all need to do, appreciate the simple things in life. But that's amazing. Thank you so much for sharing everything today and sharing your wonderful practice and what you do. Where can people find you?
You can find me on social media. It's Wake Up and Smell the Rosay on Instagram and TikTok. And my website is also wakeupandsmelltherosay.com.
Beautiful. And congratulations on your own journey and coming through to the other side of your own eating disorder and now being able to help others. That's phenomenal. And I'm sure a lot of your clients and people within your community are very grateful for what you're doing. And I know I am, because we need more people like you in this space. So thank you for doing what you do. And
Oh,
then
thank you so much.
Right, and then thank you so much to everyone else out there for joining us today for another Secret Sunday session. It has been an amazing conversation with Natalie talking about eating disorders, and we are very grateful to have you to tune in and start the conversation with us. So thank you, everyone. Have a great Sunday, and we'll catch you all very soon.